This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Ocdox 100 tablet is a medication designed to treat depression and obsessive-compulsive disorder, OCD. It contains fluvoxamine, an SSRI that helps balance serotonin levels in the brain. Indications and uses. This medication is indicated for the management of depression, a mood disorder marked by persistent feelings of sadness and loss of interest, as well as obsessive-compulsive disorder, characterized by recurrent, ego-dystonic thoughts and compulsive behaviors. It is also used alongside lifestyle changes to enhance treatment outcomes. How it works. It works by increasing serotonin levels in the brain, which helps to improve mood and alleviate symptoms associated with depression and OCD. Directions for use. Take this medication as prescribed by your physician. It should be swallowed whole with water. Do not crush or chew the tablet. Your doctor will determine the correct dosage and treatment duration based on individual health factors, including age and body weight. Possible side effects. Common side effects may include agitation, anxiety, constipation, diarrhea, difficulty sleeping, dizziness, and headache. If any side effects worsen, consult a healthcare provider. Precautions and warnings. Before starting treatment, inform your healthcare provider about any existing health conditions, especially cardiac issues, liver or kidney problems, or a history of seizures. Pregnant or breastfeeding women should seek medical advice before use. Avoid alcohol and caffeine as they can exacerbate side effects. FAQs. 1. Can I stop taking this medication if I feel better? No. Consult your doctor before stopping as sudden discontinuation may lead to withdrawal symptoms. 2. Can it make me sleepy? Yes, sleepiness is a common side effect. Avoid driving until you know how it affects you. 3. Can the tablet be crushed? No, swallow it whole with water. 4. Is it safe to consume alcohol? No, avoid alcohol as it can increase the risk of side effects. 5. Can it be taken during pregnancy? It is not recommended unless deemed necessary by your doctor. Thank you for watching this video. If you have any questions or suggestions, feel free to leave a comment below. Your feedback is appreciated.